Good afternoon, and thank you, Mayor Bowser and other officials, for highlighting the importance of childhood and adolescent immunizations. I've had the privilege of serving as the community pediatrician for over 10 years in Southeast DC, and recently assumed the role as the medical director for the Children's Health Center at the ARC and the Mobile Medical Program, alongside with committed nurses, administrators, and other physicians. And we've served throughout the pandemic. The COVID-19 pandemic has led to a significant decrease in routine childhood immunizations. Recent data from the Center for Disease Control and Prevention shows that we still have significant work ahead to get all children caught up with their immunizations. This will prevent an outbreak of diseases like whooping cough, chicken pox, and measles, for which there exist safe and effective vaccines. We encourage parents and caregivers to schedule appointments with their primary care providers to ensure that children are up to date with their vaccines as well as with their routine well visits. This will ensure that children are healthy and ready to learn for the upcoming school year and beyond. I would now like to welcome the Honorable Mayor Muriel Bowser to the podium.
Thank you. Let's give Dr. Rhodes a big round of applause, and all of our doctors, nurses, healthcare professionals at Children's National, the premier hospital for children, but more than that, health providers in our community. So I am delighted to have you join us, and I'm glad you're thinking about how our families in DC are going to spend the end of school and the summer preparing to make sure their children are up to date on all of their vaccinations. I am fortunate to be joined by a number of our public schools team as well as our public health team. So let me start with acknowledging Dr. Christina Grant, who is the superintendent of the Office of State Superintendent for Education, affectionately known as OSSI. So thank you, Dr. Grant, for being here. We're also joined by Dr. Louis Farably, who is the Chancellor of the District's Public Schools of DCPS, and Dr. Michelle Walker Davis, who is the Executive Director of the DC Public Charter School Board. They, of course, are responsible for making sure every family is connecting to a great school, that you have the out-of-school time supports that you will need in the summer, and, of course, that your children have their social and emotional supports and are getting connected to vaccination. Your child being vaccinated is also a requirement. And we know that everyone has been disconnected from their preventative services in some cases during the course of the pandemic. Everyone here at Children's wants you to know that it's safe and it's time to come back to the doctor. We will also be talking about ways that you can connect to the vaccine right in the community. I know that Councilmember Christina Henderson has joined us, and she in her work on the council is also very focused on how we are connecting our families to vaccination, and she wants to remind us as well that it is a requirement. And I'll turn to council member after I finish, just a couple remarks. I want you to know that we are increasing our system of support and expanding immunization access. We are conducting extensive family outreach and providing additional resources for schools and healthcare providers. This citywide multi-agency partnership aims to improve compliance rates this summer and into the fall. And I have a homework assignment. I got this from the superintendent. She told me that your homework, DC families, is to get your child vaccinated this summer, and to do it as soon as possible. Make your appointments, make your plan, and get it done. District law requires all children to be up to date on their vaccinations in order to attend school. And we don't want a single child to miss a day of school So the Office of the State Superintendent and DC Health will work with our schools to help families make sure that they are in compliance. Dr. Rhodes will tell you that the best place to get your vaccination is at your medical provider's office. They know you, they know your child, and they are the best ones to answer your questions about vaccines and to check in on any other health related problem. They can also complete a form that is necessary. I've gotten to know this form very well. It's the Universal Health Certificate. This is the medical form that your child will need to return to school and that school nurses use to make sure children have done and their families have done what they need. And it also lets the school nurse know what to do if your child becomes sick during the school day. Pediatricians are waiting for your call. They know that many kids need to be brought up to date on their vaccinations, and they are expecting and waiting to make appointments for you. To help make it easier, beginning this month, DC Health will expand access to vaccination services by offering additional school-based, community-based health clinics. So families with children ages 4 and older can visit any school-based health center, regardless of where your child is enrolled, for a vaccination-only appointment. DC Health is also working with several community providers to place mobile units like the one behind me at or near schools, rec centers, and our COVID centers in other community locations in all 8 wards. Families can expect to hear from us by phone and mail if your student is missing one or more school-required vaccinations. We also know that our schools have been on the front lines of engaging and supporting families and getting vaccinated, so thank you to our principals, one of many, many important tasks that they have and that they do so well with our families. Schools can request on-site clinics through our vaccine exchange to have a provider visit your school and administer routine pediatric vaccinations. So I'm going to stop talking there. I'm going to invite the council member to join us. And following the council member's remarks, we will hear from Dr. Thomas Farley from DC Health and Superintendent Grant, and then we will answer your questions. Council member.
Thank you, Mayor Bowser, and good afternoon, everyone. This is, I know for my colleagues and I, we've really been pushing in terms of getting children vaccinated and up to date, not just with their COVID vaccine, but their routine childhood vaccines. I joined Children's last summer at some of the clinics that they did, and I will happily do it this year as well. So we want to encourage families not to wait to the last minute. Go ahead and schedule that now so that you can get in for an appointment, because I think anyone who has young children know that when you call the doctor's office and they say, oh, we don't have any appointments till September, you have that frustration that builds up. But also looking for the mobile units that will be out as well, and help out your neighbors. There's some neighbors who may not be plugged in, who may not know that they could come down to the ARC, or that if there's going to be an event where it's at a school or a mobile event, you know, I think the good folks at Children's and our partners with OSSI and DC Health really make it a fun experience for families. But this is so important because as we are moving and the numbers are certainly declining for COVID-19, we don't want to have another outbreak of something else that can be prevented. So I hope everyone gets what they need. Thank you.
Thank you. Thank you, Dr. Farley.
Thank you very much, Mayor. For the past 2 years, while we've addressed COVID, we know that many other issues have been put on hold. People have avoided getting preventive medical care of all kinds. People have not had their blood pressure treated well or have not undergone cancer screenings. And many parents have avoided getting in-person care for their children. And the most important consequence of that is that children have fallen behind on their vaccinations. Now, vaccines are probably the greatest advance in the history of medicine. The many once dreaded diseases like diphtheria have now disappeared. But there are some vaccine-preventable diseases that haven't quite disappeared and continue to pose a risk. So, for example, measles is still circulating around the globe, which means that it's just one plane ride away from DC. and pertussis is circulating in the United States. Before COVID, we had about 10,000 cases of pertussis, which is whooping cough, in the United States each year. Both of those diseases can be serious or even fatal in children. Now in D.C. today, according to our computerized immunization registry, only 80% of our children in kindergarten have had 2 doses of the MMR vaccine. That's the vaccine that prevents against measles. And only 79% of children in kindergarten have had 5 doses of the DTP vaccine. That's the vaccine that protects against pertussis or whooping cough. Now, because many children get vaccinated outside of D.C., our data is likely to be somewhat incomplete, but still those percentages suggest that there are not enough children vaccinated in our district to prevent an outbreak in our schools. And I should note, if there is an outbreak in our schools, even children who are vaccinated are at risk, because these vaccines, while they're excellent, they're not 100% perfect. So some children can still get infection, and then there are some children who for medical reasons can't be vaccinated. So to protect all of our children, we want to have all of our children vaccinated to close those gaps. Now, as the mayor said, and I really want to emphasize here, the best place to get your child vaccinated is where he or she gets regular pediatric care. Your pediatrician or other primary care provider who knows your child can answer your questions about vaccinations, can address any other medical issues at the time, particularly medical issues that a new provider may not know of, and can complete that form, that universal health certificate form. That's important for all of that, and the children need that to go back to school. Now, the pediatricians know this, and they're expecting parents to bring the children in over the summer. So parents, please make your appointments now. And after you get that shot, make sure you get that form, that universal health certificate form or other documentation so you can bring it back. So if there's any question, you can show that your child's been vaccinated. Now, our goal is to have 100% of our children vaccinated before the first day of school so that not a single child misses a single day of school. So we're going to be notifying parents about the need to get up to date beforehand. We will have messages in the mass media, like that message right there, that people will be seeing. That's general messaging. In addition, we will be doing phone calls to parents of children who in our database are not up to date, starting this week. We're using our contact trace force. People redirect them that.
Thank you.
Yes, and so listen for that call. And then there'll be school-based staff that you'll hear more about, I think, in a minute. They'll be sending letters to parents throughout the summer. So parents, if you get a call or a letter, pay attention. Listen to the messages and get your child vaccinated. Now, in addition, as the mayor said, DC Health is working to make it even easier to get your children vaccinated. We're working with other providers, like Children's, to provide a variety of additional access points, including walk-in, vaccination-only days at their existing sites, so that if they're short on appointments, you can still bring your child in and get them vaccinated. And then, as the mayor said, vaccines at school-based health centers, which ordinarily only treat students in those high schools, they'll be open over the summer to any child to come in and get vaccinated. And then mobile teams that use vehicles like this that will be available to go to schools with the lowest vaccination rates, as well as other sites. So if we do all that, and if parents do their part, we can protect all of our children and have not a single kid miss a single day of school. Thanks very much.
Good afternoon, everyone. Thank you, Mayor, so much for bringing us all together today, and all of the doctors, Dr. Rhodes, Dr. Farley, Dr. Farabee, Dr. Walker-Davis, and council member. It is exciting that we are all aligned on one message, which is do your summer homework and ensure that you have signed up and had your children adequately and appropriately vaccinated for school. As Dr. Farley noted, for the past year and a half, we have rightfully been focused on protecting our community, our families, our children, as we manage this pandemic. But as the council member noted, as we are coming out of the pandemic, it is critically important that we do not forget that the other infectious diseases that exist can also impact and affect our children and our ability for our children to come to school, stay in school, and be at the safest place we all know our children should be, in school. As the mayor also said, vaccinations save lives. It's a part of our continued commitment and effort to make sure that our students have all of the options, all of their vaccines, and the wellness set of services that they need so that our schools can stay open. That includes having access to routine pediatric vaccinations. We are lucky, so lucky, to have a strong pediatric care community. And I want to acknowledge again Dr. Rhodes and the great leadership here at Children's and all of the pediatricians across DC that are ready to serve our families as we endeavor to make sure that our children have their immunizations. Again, as you've noted, as the state superintendent at OSSI, we're going to play a critical role in helping everyone do their homework assignment. You have heard everything from the role that DC Health is going to play. We will be partnering with all of our schools, district, charter, parochial, to give them guidance, to give them templates, to support the contact tracing task force that will be calling families and ensuring that our children can start next school year stronger than ever, and that includes them having their vaccines. As the mayor noted, your health certificate is a document that families should have. It is the tool they can use to show that their records are up to date. And we want all of our children to be immunized within the first 20 days of next school year. And so it is why we are standing together in June and issuing this challenge today. And I want to be clear, this is one of our top priorities. And it's critically important to making sure that our next school year starts strong. We've worked really, really hard this year to keep our school doors open and to keep our children safe. And this is the next step in our journey. Our children belong in school with their teachers and friends where they can learn. We will again be providing a tremendous amount of resources to push this work forward. And we're starting early, and we're starting today, and we hope you join us. And so we look forward to hearing that families are completing their homework assignment and getting these shots in, and look forward to engaging in any questions you might have. Madam Mayor.
Thank you, Superintendent. Why don't you guys stay close for questions. I also wanted to acknowledge our Ward 8 community, and who's represented today by Salim Adolfo, who is the commissioner for ANC 8C07. So let's give our commissioner a big round of applause. But also a very important person on our team, the Ward 8 Mokers. And her name is Christina Washington. And Mokers represents a very important title in our administration. Those are the representatives of the Mayor's Office of Community Relations. So when you see Christina in Ward 8, give her a lot of work. She represents me, and she's going to tell me what Ward 8 needs. So make sure you look for Christina at our events. So with that, we'll take a few questions. Yes, Sam.
It sounded like that people needed to catch up
Yes.
because there's been so much focus on COVID. Is that the case? And basically, when is the point at which you've got to be vaccinated or you can't go to school?
Yes, it is the case. We have talked a little while, and I don't think that we're alone in the country, and families and kids who haven't been able to keep up with their normal childhood vaccines. And Dr. Farley may have the specific numbers of kids who need to catch up, but also be prepared for school. Dr. Farley.
As I said, it ends up being about 80% of children in kindergarten we know are up to date. There are probably more that have had shots, we don't have the data on that. So there's a big gap that we need to close. As to your second question, the law says that they have 20 days after the start of school to be finally up to date before they're excluded from school. We don't want to wait 20 days. We want our children to be all up to date as of day one.
Were some kids not up to date this past school year?
According to our database, yes.
And that's what you're saying, is that the difference between 80% and the question mark?
Correct.
Okay.
Yes, Perry.
Do you have any data for other grades? No. Why is kindergarten what separates kindergarten from the others?
You know, kindergarten is a standard measure for sites across the country. They need to report that into the Centers for Disease Control. So that's how we analyze our data.
And will undocumented students be able to access these vans?
Yes, undocumented students can access vaccinations at a number of sites throughout the city, vans included.
It is.
Yes, it's free. Free.
So I apologize for getting here late and asking you something you may have already answered.
Sure.
But so these vans, they'll go around to schools that you said were most risk of having, I guess, the highest gap. Can you tell us what vaccines will be offered in these vans that go around?
Sure.
Thank
So
you.
perhaps, Superintendent, if you would talk a little bit about the whole strategy about where to get vaccines, what we're doing with the vans and COVID centers.
Thank you, Mayor, and thank you, Sam. We discussed this briefly, but essentially we are setting up a multitude of supports, and Dr. Farley, you can come weigh in as well. We are first encouraging families to reach out to the primary health care provider of their children. We know that families tend to want to have the person that generally gives their child health care to give them the shots. But we also are creating opportunities for the mobile vans and clinics to go into communities to have access where individuals would need access to their vaccines. And we are creating opportunities for schools if they would like to have a school-based site occur at their school location. Schools can reach out to DC Health and have those resources provided. The first part of your question, Sam, is it's all vaccines. I'm sorry? Oh, sorry, Mark. My apologies. Oh, Sam, Mark, got it. The answer to the question, Mark, is that all the vaccines are available. So all routine immunizations for children and including the COVID-19 vaccine.
Any other questions? Yes.
On topic, how many of these vans, and are they going to be in certain areas more so than other neighborhoods?
Dr. Rose, do you want to talk about it? Yeah, we have 2 vans, but I'm not sure how many.
See. So Children's National has 2 mobile units, and we partner specifically with Children's School Services in order to identify the areas of greatest need. And yes, we go to all areas in the city.
Yes, Perry?
I mean, I think you have said in the past and maybe today that there will be no virtual option for these kids that don't meet these requirements. I mean, realistically, we know what's happened, you know, the vaccines numbers over the last years. If this effort doesn't yield those numbers that you want, what will happen to these kids who are not up to date or their parents do not want to get them the shots?
Well, we know, Perry, parents get kids shots every single year, and we have to get back to that cycle of making sure that our children are vaccinated. An outbreak of measles or whooping cough in a world where we have safe and effective vaccine should be unacceptable to all of us. And I have to say that the requirement will be enforced. It will be. So now is the time to start planning for your appointments and getting your kids vaccinated. Anything else? Yes.
Hey, I was wondering if somebody from Department of Health might update us on monkeypox.
Yes, Dr. Farley.
Yeah, thank you. As a press release went out, but for those who haven't seen it, there was a single case of monkeypox that was diagnosed in a D.C. resident over the weekend. We sent a report of that. I can tell you this was a male. This male had traveled to Europe, and this person is isolating at home, and that our staff are talking to this person to identify this person's contact and make sure that those contacts monitor their symptoms so that they don't spread the infection further. Not surprising to us. We know that this is an outbreak that's occurring in Europe and the United States. With more attention to this, more people will be identified. And so we expected we would sooner or later have a case. We now do have one.
So can you just confirm you're not waiting for CDC to return test results? You can confirm that this is a definitive case of monkeypox in D.C.?
Here's the specifics. Is our laboratory can prove that it's an orthopox virus, which is the family of viruses that monkeypox is part of. The vast majority of those are going to be monkeypox. So we assume this is going to be monkeypox, and that's what CDC's directives are. However, further confirmation will be done by the lab at CDC.
And what's the timeline on that?
A matter of days. I can't give you exactly how many.
And is this the first test that you conducted that you've sent to the CDC from D.C.?
No, there were other tests that were sent that were negative.
Do you know
No, there are other tests that we did in our laboratory which were negative. So this is the first positive we had.
How many have you tested?
I believe we had 2 others that we tested.
Thank you.
Yes, ma'am.
Mayor Bowser, we're less than 2 weeks away from something in the water, and given some of the recent events, especially Philadelphia this weekend, we're hearing concern from event goers that there haven't really been plans expressed from the city or the event planners yet on what's going to happen when the 3-day festival takes place. Can you talk to me a little bit about security? And the big question for a lot of folks wanting to go is, will the city be able to prevent an illegal gun from being brought to the event or in the surrounding space?
For sure, that is always, safety is our first concern. It is also our concern to use and enjoy our city and to support festivals, parades, and events. Next week, we'll be celebrating Pride in the district, for example, where thousands of people will fill our streets. So our special events task force, along with MPD, along with all of our public safety officials, work with event organizers all year and for all events to make them safe. And the same is true for Something in the Water.
How come we haven't seen a plan yet from the city?
I'm sorry?
Why hasn't there been a plan released yet on security plans for that event specifically?
Well, we're several weeks out, and when we will make the public aware of impacts to them, whether it's road closures or any special accommodations. But the public safety officials are doing internal planning.
Should the city residents expect to see half the city shut down? Can you give us an idea?
When we have that road closure plan, we will share it with you. And keep in mind that there are other events going on that day as well. Something in the Water, other First Amendment demonstrations. So depending on which of those permits and plans proceed, there could be impacts to traffic.
We've mentioned routine vaccines, and we know Councilmember Henderson has a bill in place. I mean, where do you think we stand on kids getting COVID vaccines, and when do you think we'll actually be in a position to enforce the council's requirement? I know it doesn't go in effect until there's
Let me
FDA
ask the
approval.
council member to address no longer a bill, but the law. And Councilmember Henderson, if you want to address that question.
Thanks for the question, Perry. So this is a good opportunity to clarify that it is only required once it is fully approved by the FDA. So for students who are in high school or who are in middle school, it is a requirement for them. For the younger students who are still on emergency approval, you have a little bit more time. But we've already noticed for some LEAs, as students have been submitting their enrollment documentation, the schools have been asking for it up front for kids over 5, but it won't be required for the younger children until it is fully approved by the FDA. Now, in terms of the rates of where we are, I'll leave that to DC Health or OSSI or somebody else.
And I'll just add, for those students, many of them who are unvaccinated. Some of them are not eligible for vaccination. Others are. But they're missing school right now because if there is a COVID exposure in their classroom and they're unvaccinated, they can't go to school. Is that right? So they're already missing school. So while for ages, I guess, under 13, the final approval hasn't happened, your kids could miss school if they're not unvaccinated, if there is a COVID exposure. And so what we know is that there's COVID, and there's COVID in our schools, and the best defense is using the safe and effective vaccine for your health, but also for staying in school and not disrupting your family life. Getting vaccinated will prevent that.
We'll be enforcing it for those who it is FDA approved for?
Like I said, there is a requirement for vaccines. All of the vaccines that there is a requirement for, we will enforce. And we don't want to. I'm going to tell you right now, DC Health has been adamant, and this has been our requirement. This has been on the books. But we have just seen with kids being disconnected from school and from health care, we're at a level of real concern that we could have a preventable disease circulate in one of our buildings. So we have to do everything that we can to stop that.
So it's my understanding that there's a phone banking, in terms of reaching out to parents.
Yes.
So beyond that, what other types of outreach are we looking at, for people who may not have phones and for those who are skeptical about vaccinations?
Sure. Let me ask Chancellor Farabee to talk about the outreach that DCPS is doing, and Dr. Walker Davis, if you want to add.
Yeah. Thank you for that question to the other Sam. It's good to see you. So what we have in DCPS is a number of strategies, as you outlined. It does include phone calls and outreach to families. But we take advantage of the enrollment season that we're in right now as the first step to monitor the completion of the Universal Health Certificate that we talked about today. So that's a part of the documentation that we ask families to provide if they're a new enrollee or they're re-enrolling in DCPS. If there's an outstanding record of childhood immunizations, we begin to launch outreach that can go directly to the family, which includes phone calls. It also can include home visits as well. We will also be issuing letters to the family in addition to phone calls. And also we have relationships with our parents and our teachers. And so our teachers are a part of this outreach effort as well. And each school has a health services team and an enrollment team that collaborate together on outreach to families where we have an outstanding record. I do want to reiterate the point. While we know we have the 20th day of school to meet this requirement, it's critical that, one, families enroll early, but secondly, we get all of our enrollment documents, including the health certificate, completed with childhood immunizations completed before the start of school year.
Thank you, Mayor. I will echo the sentiments of the Chancellor. Charter LEAs are doing everything that they can to ensure that parents know what is required and that they're supporting them. So one of the things that I wanted to lift up is acknowledgement of our school nurses because they are doing a wonderful job of helping families to know what is needed. And in the enrollment process in particular, our schools are flagging right now what is missing for families. They are underscoring the necessary health certificate for enrollment, and that is one of the initial touch points in addition to families' health care. So our schools are working, and we are really thankful to the mayor and to DC Health and to OSSI for all of the supports that are in place to help families get children ready for school. And we're excited for the end of the school year, the summer activities, but also to welcome all of our students back to safe and healthy school environments. Thank you.
Okay, last question. Last two questions. Yes.
DC employees going through a slow background check process that may be negatively affecting their ability for critical tutoring services and after-school programs. And the question is, why does it take so long for these background checks?
Well, Sam, I will be happy to have the Chancellor and others talk to you about that following the press conference. But I have to say, this is not a process that we can skip over or rush. Okay, I don't want untested, unvetted people around my child. So we'll get you some information. Okay.
A bit off tangent, but this is in relation to lead pipes. So,
okay.
What's the remediation strategy? You know, as far as when pipes are tested and they are well above 5 ppb, you know, in terms of with the DC public schools and the charter schools as well, especially with the schools having been shut down over the pandemic and we're just returning.
Okay. I think I might have to follow up with you about that, Sam. I don't have it on the top of my mind, but I'm happy to follow up with you. Okay. Thank you, everybody, and thanks for being in the great Ward 8. We just saw some young people from Apple Tree here who are enjoying a new playground, and we want to make sure all of our kids are connected to activities. So stay in touch with us to make sure you know how to do that. Thank you. I think we're going to see Children's that's going to show us, Children's Health that's going to show us this van. Thank you.